Hi, my name is Anish Rai Chaudhary. So today's topic is the coronavirus's impact on healthcare. So coronavirus impacted the whole world in 2000 from 2020 to 2022, and it created a large-scale lockdown and in various parts of the countries and also abroad. So it had a great impact on everyone's place. But today's topic is basically based on healthcare. So I want to focus mainly on the healthcare issues that the coronavirus has posed upon us. So coronavirus was a Wuhan virus which was spread from China. In it, it was specifically made in. It was specifically created, or it was specifically originated from the Wuhan district of China, where millions of Chinese people got infected with the Wuhan virus in the early 2019, and the deadly virus started to spread across the whole world, and it was really a great health hazard for many of the people, because from elderly to the middle-aged and also the children are all affected by the Wuhan virus that is famously known as the coronavirus. So for the healthcare, the main thing that had been impacted during the COVID-19 pandemic was the healthcare first almost collapsed during the COVID-19 healthcare. So it was really a big issue to accommodate so many patients in such a small time, and it was really a tough decision to make for the governments. We can see in the Chinese government, where in China there were specifically some temporary places made where the instruments and the gadgets were placed, and for temporary purposes a temporary hospital was made to accommodate the extra persons who were infected with the virus. And afterwards it spread to mainly US and India, because these are the most populated states in the whole China, in the whole world, and it was really a great issue for both the countries also, because they had a tough time negotiating with the virus, because it was really tough for them, and it just made the virus more vulnerable. Moreover, the Wuhan virus had impacted the whole healthcare department. Many nurses and doctors had to work for thousands of hours without taking any leave off because of the Wuhan virus, and that was really a big issue. They had forgotten the work-life balances, so that they can work on so that they can help the patients to recover and try to alleviate their pain. Moreover, the healthcare department couldn't even figure out that how to combat this virus, because it was such a virus where we don't have any cure. We can just give some supplementary medicines, or we can give some oxygens to the people who are infected with the virus to alleviate their pain, but it was not a permanent cure. And until the end of 2000s and 2020s and 2021, before that there was not even an injection also. So the people who were not even infected, they also were very much afraid of that virus. So the most important thing that people have known after this was that we have to be always prepared for this type of viruses that can cause a major outbreak of the of deaths that can happen in the whole world. So Wuhan virus or the COVID-19 have given us the example that we should be always ready in terms of healthcare to fight out these viruses, and we should have the accommodation and we should have the people necessary to fight out and defeat the disease as much as possible. Because I have also found out in many countries there was very much lack of medical resources during that time, and many doctors and nurses have been infected with COVID-19 because they have also been trying to alleviate the pain of the COVID-19 patients, and they also contracted with that virus, and it was really an issue for them also. So the whole healthcare collapsed, and we should always try to have more medical resources so that we can accommodate this type of unnecessary medical health hazards that happened during the COVID-19 pandemic. So this was about the COVID-19 pandemic and its impact on the healthcare, and I am glad that you have listened to my video till this time, and I think that I will come up with another video. So thank you and bye bye.